Hello and good evening, I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Extreme weather, environmental degradation and climate-driven displacement are placing new pressures on health systems worldwide, especially in settings of existing vulnerabilities. Medical humanitarian organizations are now saying these pressures are no longer episodic, but constant instead. And joining me on the show to discuss this more and the human cost of climate emergencies, I have with me Dr Maria Guevara, who is the International Medical Secretary of Médecins Sans Frontières, better known as Doctors Without Borders, or MSF for short. Dr. Maria, thank you so much. Maria, thank you so much for being on the show with me today. I really appreciate you joining us
Thank you.
while you're in town giving a workshop to MSF field staff. Talk to me a little bit about how this impacts your people who are in the field. So MSF works in crisis zones long before governments declare them emergencies even. And I'm curious to know what you're seeing in terms of how climate stresses affect or impact field operations.
So you've rightly said that MSF is usually in the conflict settings. And if we really look at the work of MSF through the years, and especially in the last few years, we are more and more again in conflict situations. But that's been compounded. So what we're seeing as medical humanitarian actors and those who are working in humanitarian settings is this triple crisis, and many have said this before, it's the triple C of climate, conflict, and contagion. Because those are actually interact and intersect with each other and compounds each other. It's partly because of the actual impacts, direct impacts of each, but then it's also the race for the resources. And then by part of what's at the heart of climate change is also this environmental degradation impact of broken human systems that are not in equilibrium in natural systems, and that then creates also more disease processes. So how those connect is creating this kind of emergencies that are out of scale of what we're used to, right? It's scales that are much larger than we have ever seen. Storms that are much more severe, much more frequent, and scales of food and water insecurity that are compounding on top of each other. And so we're stretching our limits to try to answer to all these emergencies. And then also going back to what you said before you even know it, because what's at the heart of climate change are already the impacts that are of losses and damage being felt today by those who are exposed to most vulnerable situations. And those are the humanitarian hotspots. And so what we see are the hotspots of humanitarian hotspots are also climate hotspots. Unfortunately, as we see climate change record highs of warming, 1.5 degrees Celsius supposed to be the ceiling of the Paris Agreement, we are recording them more and more in many cases. We're already past the safe operating zone. So we're having to deal with people who are having to live in uninhabitable areas, and that's growing. So what I'm bracing for and what we're bracing for is that expansion of localities. So is the future of humanitarian hotspots not just where it is today, but global spots?
Wow. Can you give me an example of the type of how it's manifesting today, how climate stresses are being seen today?
And I think one of the jobs that I do as International Medical Secretary is looking at our mutual accountability. What did our operations look like over the year? So 2025, we're collecting the data. So I'll give you the 2024 numbers. And just in this last cycle of review, in the last 5-6 years. In 2024, that meant 16 million outpatient consultations, which is a 60% rise over the 5 years, and including on top 2 million emergency consultations, the similar numbers of inpatient admissions, but more scarily, malnutrition cases have tripled in this period of time. So we have now, if you combine moderate and severe acute malnutrition, we're seeing 800,000, but only in the areas we are in. So that's not to mention all the other hotspots.
Dr. Maria, did you say 60% rise in
our consultations in the last 5 years, tripling of numbers of malnutrition cases.
Did that shock you?
Yes, of course. Well, as true MSF form, we just adjust and address the responses. So because we are fortunate to have 7 million donors globally, private, supporting us, enabling us to respond within the 72 hours critical period of response, we're able to go where most people don't go. And therefore, we're able to reach them.
Yeah.
And so so we just keep responding as the needs keep growing. But that support enables us to grow that much. So we went from the same period, from 1.3 billion to 2.3 billion euro budget, because that growth was that much needed. But that means the same growth, a doubling of our staff globally. So just head counts is 67,000. Protecting that head count and keeping a safe and secure work environment is a challenge when the number of armed conflict situations are becoming even more deadly, which is the 5th deadliest year, 2024 was, recorded by experts' analysis, the 4th most violent, with more attacks on healthcare. So these are impossible situations that we're seeing and having to grow and respond to an ever-warming world.
Yeah, okay. So talk to me about the component of the climate crisis, because we have, as you said, you've got conflicts already, you're exacerbating, conflicts exacerbating existing vulnerabilities. Then you have climate, which you have extreme weathers. And often I think, especially when I talk to people, when we talk about the climate crisis, or even if calling it a climate emergency, everyone thinks it's a future problem. It's something we'll have to worry about in the future. Future generations will have to deal with the repercussions. But we're seeing it, you are seeing it today.
Yes.
MSF is eyewitness to it today.
But let me just go back a decade ago in Asia Pacific. Here, where we're sitting today, Typhoon Haiyan.
I recall.
So Philippines, as a Filipino by background, we're used to typhoons. But at that time, that was the most severe that we've ever seen, Category 5. 10 years later, it's become the norm. Right, you see such extreme categories. You see black categories of typhoon hitting Hong Kong. You see this, and you see typhoon just hitting in numbers and numbers, on top of which are other kind of natural disasters, as we sit in the Pacific Ring of Fire. It's this compounding effect in a megalopolis Asian city where billions of people live. That means more people are exposed and more people are having to fall victim to such. So without preparedness, you're gonna lose lives. And so in these settings, you also have the heat waves and everything that implies, and the other impact of getting hit with trauma, the mental health and the eco-anxiety, compounding on each other. When your cities are not built to absorb that much rainfall, you have wonderful standing pools of water, beautiful for mosquitoes to breed and love to transmit dengue and other infectious diseases. So these are all compounding in one setting. You're going to have to be challenged. So back to the climate scenario workshop that we're putting together is, how do you prepare for that in a 2-degree world, in a 3-degree world, in a geopolitical changing landscape, with economic changing landscape, with technology a changing landscape. So these are all things that we try to create compounded scenarios to be better prepared to what we invest in today.
Right.
I just want to add one last thing, and one of the reasons we wanted to do this in Asia Pacific, not only because we have operations in the region, but because the amount of capacity, brain capacity, and research and technology in the region is where we need to find the partners to identify where the expertise are. And this is also part of why we're here. Hence, the Sunway Center for Planetary Health is one of the co-hosts of this workshop, is how do we build this framing and work together? And also, Malaysia has also used the framing of planetary health, and we want to make sure that we learn from this system and how to actually help formulate our responses accordingly.
I love that planetary health is now becoming more and more understood by people. I think after the pandemic, we realized that no system stands alone. Everything is interlinked. How do you see planetary health, particularly from a humanitarian medical perspective?
So I personally believe very much around planetary health because it is this ecosystem of interconnectedness. As a humanitarian actor, we are addressing the impacts of inequalities that is brought on by the structural violence of our human systems. And at the heart of planetary health is that the human systems are not compatible with natural systems anymore. So we're changing this equilibrium of balance. And by doing that, we're creating this kind of crazy cascade of emergencies and ever-rising inequality. So when you're hitting all these planetary boundaries and you don't have the proper framing because your governance is not correct, you have not invested in your knowledge and capacity to implement that at the core of planetary health, then you're missing the point and you're not prepared for not only today, tomorrow, or the future.
Your job is doubly hard because you're going to have to prepare MSF globally for this. No, I mean, no pressure. But
oh, no, I feel the pressure.
Talk to me about preparedness. How would an organization, an international organization like MSF, think about how to prepare for climate emergencies in the future?
So one of the best things, one of the things that you need, in climate speak, you have the mitigation pillar. So at MSF, that's one of the pillars. We have a 3-pillared approach. One is mitigation. We look at how do we do more sustainable practices so we do not contribute. We do no harm in the workspace that we do. We do our work to reduce the carbon, but not only, managing also more alternative, sustainable electric supplies, for example, energy
so you
supplies.
think about how much you're contributing in terms of emissions as well.
First and foremost.
Wow.
And then, well, before I go to the second pillar, which is adaptation, just a word on that, because the fact that we have started to do hybrid hospitals and facilities where you have many solar panels and battery that is fed, as well as the usual generators, because sometimes you just, when there's nothing else. When you are in a sometimes conflict situation and you are barred to come in with supplies, you cannot bring in the fuel to run those generators.
Right.
How do you run a hospital? Because we have solar panels, we have been able to save lives because we can continue oxygen. So that is part of why mitigation is also so key.
I didn't think
and
of that.
especially in frugal areas and low resource areas. The second is how do we do anticipation? And this is the preparedness. Early warning systems, for sure, this is something that is well established in the region as a region of disaster, prone to disasters, but not only. And how do you translate that at the health facility level? So we've been trying to do more anticipatory kind of tools where you take facility data, layer that using machine learning with meteorological data, then you can predict where maybe a malaria outbreak might be, and you go do more seasonal chemo prevention. So very targeted, climate smarter prevention. And that's what we try to do. And then because we one of our parts of our principles is witnessing, we listen to the patients and our staff who are living the day-to-day reality of climate impacts and give voice to that. So because in the larger scheme of things, there is a dearth of information and data coming from developing countries, and we need to empower that voice, provide evidence-based experience that it goes into big policies or collection points like the IPCC, the Intergovernmental Panel of Climate Change, in their assessment reports is important because those define policies. So we add our voice to that. So one of the things that we've been doing has been to contribute to the Lancet Countdown that's tracking the climate change in health, and is really showing where the climate change induced by humans is really contributing to the changes. And in their last report, 2025, 84% of the heat wave days faced today, they can attribute in the last 5 years, can be attributed to human-induced change. And that has led to 60% increase over a decade of collection of deaths. So, and then we match that with the reality of what we see. And so we give voice to from the humanitarian perspective. And because of that, we also go to the conferences of parties, the COP. And the COP 30 this year, I had participated, which was very emotionally interesting.
Oh, in what way?
Well, because I've been to the other COPs, and those were the COPs of oil, they say, because it was in Dubai and Egypt. And this was supposed to be COP of the people and truth.
In Brazil with
Belém.
Yeah, Belém, yeah, that's right.
At the gateway of the Amazon. So you saw the Amazonian tribes living in the Amazon River basin from Peru and all over South America, traveling for days and weeks on a boat, buses, boats, etc., and 200-ship flotilla of 200 tribes marching together, calling to save their home. But they're standing outside the gates of the conference of parties. So all the negotiations, the people affected. You couldn't see it more starkly, but the power of the community to say, save our Amazon, because actually the Amazon is one of the biggest carbon sinks of the world. And it's dying back. It's no longer a carbon sink, it's starting to be a carbon emitter because all the degradation of the area. And this is the tipping point, and that was one of the important voices I heard. The second was the scientist who's flagging our Earth health, planet health, is sick. And we are close to tipping points that once you tip over, will create irreversible cascades. And I came out going, oh wow, I've been calling climate crisis as a health crisis, as a humanitarian crisis, and it is today, but it is a matter of survival for all of us. And it had mobilized me to push harder on what we need to do to inform all of us to do better.
So when you're observing all of this, you're experiencing it, you're there in the moment, and you see how climate change disproportionately affects the people who have contributed the least to it. How do you make sense of that when they're the ones being impacted? We're the ones being impacted the most.
And this is why our voice is to speak to that truth, the reality that we're seeing, and the weight that MSF has in that sense of our globality, and that we are part of that larger community of affected by sheer proximity and sheer work together. We hope that our voice can contribute to the platform and give the platform for the indigenous tribes. And I think, again, this is part of why the advocacy pillar is key in our climate action. It's giving voice to that.
Right. So in speaking on behalf of or highlighting the voices of the people who are experiencing climate change as a reality, and you talk to governments at the highest level, I'm curious to know how they respond. What are you telling governments? How are they receiving this information? And are you seeing them act?
So it's very interesting, having watched the negotiations these last few years. And they have their groupings, right? You have the small island states, you have obviously the global north, you have the G77 plus China, and the negotiations between mitigation, which is at the heart of the Conference of Parties, and the link to adaptation, which is really what the developing countries, because they're not the big emitters, right? So where do you put that money and who is responsible for what? And you can see that play. So our tactic is add our voice to the reality and highlight that common but differentiated responsibilities and the impacts of that. But we also speak to the governments to say, we're partners with you, especially in these areas. How do we help you in responding? How do we help you in an adaptation? And this is what we do for mitigation. And sharing our experiences and how do we contribute to build the evidence that you need.
Can I just ask you in this region specifically, say looking at Southeast Asia specifically, which is very climate exposed, we have highly exposed to climate risks. What is it that you're hoping governments here, policymakers here, start prioritizing or stop doing even, stop ignoring even? What would, if you could distill it into a key message for them?
Well, the first thing that needs to happen is the fossil fuel phase down. But the way the ASEAN and the weight of the ASEAN together to create a voice for the people and the impact of the people, that should be a consistent voice together. And what's really, again, I'll go back, what's really interesting from the Malaysian government is this planetary health frame. So finding that common language that you can speak together and being exemplary to the different models of sustainable practices can really amplify, and that's the beauty of this, of multilateral platform like the ASEAN. You can amplify that and enable different neighbors to address the inequities, right? Because it's not just inequality.
You're right.
It's enabling, giving a ladder for the ones who have less. And this is sort of, that spirit has to be there. And so it's a learning. And how do we learn together and do together? And one of the things that we're trying to create in Malaysia is a hub to really start to look at this, because it's in real practice for us. When we look at our sustainable practices, for example, so we have a hub for here that we're trying to establish to look at access to quality medicine. But quality medicine and products, when you're looking at climate, could be a better moving away from single-use plastics, like IV infusion sets, which has PVC in it and it leaks plastic in your system. What can be the innovation to use alternative packaging? Because that's healthier for the system and for the environment, for humans as much as. So these kinds of technology is really interesting also to do together. There's so many, and that's platforms. How do you do sustainable supply chains? And that's one aspect of why we're here, to create that kind of bridge and support that we're looking at as we establish our footprint here.
I'm fascinated by this. You've brought up a lot of aspects that I hadn't even considered as part of the way you can change the way you work and the way you help people and also help the planet. Dr. Maria, do you have a quick message that you'd like to convey to our audience about the work that you're doing and why it's important that we care about how the climate crisis impacts us all?
So what's really interesting is we opened our ceremony and we had a beautiful guest speaker, Professor Abby and Dr. Amir, and also Ms. Sally Edwards from WHO Regional. And the title of that opening ceremony was Everything Everywhere All at Once. I love that. So everything everywhere is all at once, but it affects differently everybody. But each and every one of us has a role and responsibility. And the answer to everything here is actually, how do we stay in solidarity as a larger community of humanity? And each in the individual role responsibility to increase our awareness and knowledge about climate change, but also how can we be solutions collectively.
Thank you so much
You're
for
very
coming on the
welcome.
show, sharing what you have witnessed.
Thank you for having me.
You're most welcome. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.